Thank you all for coming to Health 2.0 New York City in Hoboken, New Jersey. We cross the Hudson. Yes, we can. We have bridges, we have ferries, we have paths. Incredible. So I want to thank everybody for coming out here tonight. It's a great event. We're talking about patient empowerment and connectivity. There's nothing more important than the patient when it comes to health care. And sometimes we forget that, unfortunately, providers and payers. And other incredible stakeholders. So hopefully you had a good round of demos upstairs. We had 7 demos that were invited, startups. One unfortunately couldn't make it. Her daughter was going into labor and she had decided not to get on the plane. So we wish her the best of luck and wish she could have been here. It was Health Ponds, so if you were wondering why you didn't see them, that is why. So tonight's agenda, after you voted for your top 3, first, we're going to kick off with a keynote address on patient empowerment from Daniela Koren. And she's going to start out. Then we're going to go announce the top 3. And they're going to come up and get in front of the Shark Tank of judges. Michael, hopefully, is in a good mood tonight. So we'll see. But first off, I really want to thank a couple key people that really made this evening happen. First off is Epion Health. If we get a round of applause for Epion Health for hosting us tonight. Thank you, Joe Blewett, and your entire staff. Great job. I also want to thank NJIT, New Jersey Institute of Technology, and their Innovation Institute group for supporting Health 2.0 New York City and helping us with this great event tonight. So round of applause for NJIT. Also, MedStarter is the other sponsor, which is the top healthcare crowdfunding website. And they have helped fund over 150 companies in the last couple years. Some of them have gone on to be incredibly successful. One was started by David Chase, which was bought by WebMD for about $54 million. So, and a lot of those companies actually started pitching in meetings like this. So there's no question that if you're persistent and you get out there and you network and you demo and you demo and you demo and you demo, you can hit it. So I want to thank you. It's a good cause. There's nothing more important than advancing healthcare. That's why I do it. And I think that's why a lot of us are here, because we think it's the most important thing that we can do. Not that we don't need more cool video apps and other things out there that keep my kids busy at night, but we're here for healthcare tonight. We're here for the patients. We're here for the caregivers, the providers who are overwhelmed with patients and cases. That's why we're here tonight. So thank you very much. I'm going to introduce Joe Blewett, who would like to say a couple words from Epion Health.
Thank you, Anthony. So I'm just going to be brief. Just want to say hi and welcome, and I guess offer our location here in Hoboken as a place where all of you can feel welcome to come and talk about healthcare and digital health in the northern New Jersey area, just right across the road. Right across the river from New York City. So we have a great view, but we don't have to deal with all the traffic getting in and out every day. So really just to say welcome and thank you to Anthony and the Health 2.0 community, especially Health 2.0 New York City community, and our fellow sponsors, NJIT, and their innovation group. It's just a really budding and growing community, and we're really just very honored and proud to be a part of it. But just want to echo what Anthony was referring to about being a startup and kind of be out there just hammering away, trying to get people to listen to what we have to say. We've been doing it for, I guess, at least 4 years, 3-4 years, kind of a minimum. And we met a lot of our employees and our partners through the Health 2.0 community. And I really owe a debt of gratitude to you and Alex Fair and the whole community of Health 2.0 New York City for all the connections that they've helped us to make over the years. It's really unbelievable. If I drew a diagram for you, it would be unbelievable how many connections we made based upon this group, mostly on the other side of the river. So it's great to have everybody here on this side of the river. And I just want to very seriously and very sincerely offer to anyone in the room today, if you ever like to come by and just talk about healthcare, or if you think that there's something you can do with Epion that might be positive and provide some, I guess, double impact if we work together, please reach out. we're all about working with partners and finding folks that are looking to do the same type of things that we're doing. So please feel like this is an open door to anyone who would like to come in and talk and to be a part of our group. So thanks again to you. And then also wanted to, go ahead, Anthony.
Also, after the event tonight, we will have a little after-party networking at Wicked Wolf, which is over on Frank Sinatra Drive around the corner. So please join us. Hopefully the networking can continue there. Also, just want to let Travis from NJII say a word or two. If you're unfamiliar with that wonderful institute, I think it's important you guys hear about it.
No, I'm good. Okay. I think I'm just going to intro Danielle in a second.
Okay, yeah, I'll let him do that last. Just very appreciative. My name is Travis Kahn. I'm here actually probably representing Judith Sheft, who would be in my place if she were not in Indiana right now. So at the New Jersey Innovation Institute, we're a corporation, a subsidiary of NJIT down in Newark, doing a lot of great things, but in particular, NJII was set up to really facilitate a lot of the great work and early innovation that is so desperately needed by so many different industries. And various groups within NJII are really focused in different spaces. Ours in particular is health IT. So myself am a program manager. Mike Ehrlich is our instructor for a health IT connections program that we run twice annually, spring and fall, somewhat coinciding with the school year, if you will. But really the sessions are intended for growth stage health IT companies to help them better understand not just who they are and what problem they're solving, but really making inroads into the healthcare space to run pilots, get new customers, and really kind of develop their business for that next stage of growth, that ratcheting up stage once you've achieved traction. So happy to speak myself. You'll hear from Michael. Again, we're just so happy to be engaged. We're trying to be involved in as many things as we can with Health 2.0 and with MedStarter. So thanks to Epion. Thanks for having us.
Thanks for being here, and thanks for co-hosting. So what I'm just going to introduce our keynote speaker this evening. It's Daniela Corin, and Daniela is a friend and also a partner of Epion Health, and we're working together on some products and some patient engagement portions of our solution, and she has a very long history and kind of really a well-known name in the patient engagement area. And Daniela also has a company called Arches Technology. She's a CEO of Arches, and she literally is one of the renowned experts in the field of patient engagement. And tonight she's going to talk to us about her thoughts on patient engagement, and I'm sure that you're all going to learn something and be able to go home tonight saying that you're glad you were here. So without any further ado, I'd like to introduce you all to Ms. Daniela Corin.
Can you hear me in the back? Okay, great. So what do patients really want? How do we connect with them? That's the theme for tonight, and I was happy to walk around and hear some of your pitches and learn a little bit about how you're planning to connect with patients through different apps and different medical devices, even different services. But how do we know how to really connect with them and what patients really want? Because that's what it's all about. A couple years ago, I was sitting in a room with a bunch of marketers, and we were talking about lupus patients. And we were talking at that time about reaching them in a mobile way. And one of our clients, the lead client, put up her hand and she said, let's just stop talking about mobile because lupus patients don't have smartphones. And I looked around the room and I was like, is anyone else thinking what I'm thinking? How do you know that lupus patients don't use smartphones? That's a really odd generalization, and I kind of made a mental note that I wanted to check on that. But the point is that we really need to find out who we're talking to, how to connect with them, and what we do at Arches is really think about how to fill the gap between providers and patients. There are so many appointments that patients have, so many different interactions, whether it's with an app or with a healthcare provider. But oftentimes, I'm sure we've all been there, you walk out of the office and you're a bit confused or overwhelmed, maybe you got some bad news and you're not really sure what to do, and you can't remember what the doctor told you. So what we really work on is how to engage the patient, support the patient, provide them with education in between those interactions so that they can be motivated, they can be successful, outcomes are positive, And that's what we've been focusing on for the last 15 years. We have a platform that facilitates that, and if anyone wants to talk to me about that, you're welcome to. But I'm going to be sharing insights today about how we really can connect with patients and what patients want. So at the end of the day, trust is at the core. Healthcare providers want patients to trust them, and patients really want to trust their healthcare providers. And where it meets in the middle is really that relationship building. And the relationship building has to be a value exchange. There has to be something there that the patients value, that the doctor is valuing, and together, that's where the connection really happens and the trust happens. Joe's been on me about reading this book since I've met him, I think, and I'm only up to chapter 3, I must admit. But yesterday on the plane, I was diving into it, and I saw this quote, and I had to put it in because it was really relevant. Validated learning, which is what he calls this methodology, is not after-the-fact rationalization or a good story designed to hide failure. We must learn the truth about what customers really want. We must discover whether we are on a path that will lead to growing a sustainable business. That's why everyone's here today. Those of you who are pitching are really trying to discover if you're on that path. So what I'm going to talk about today are 7 insights that my team and I have collected over the years about what patients really want. 3 pillars that I believe are really key in building those relationships with patients, and some tips. So no matter what you're building right now, and again, I saw some apps and some devices, content and education has to also be at the core. It's not enough to just provide a patient with a tool. There has to be the surround sound. That's really what's going to engage them and keep them motivated to keep with your app or keep going back for that test over and over again. If they're supported, they're going to want to use what you're providing them. So insight number 1, when you're developing content, and a lot of what I'm going to talk about is developing patient engagement content around your service offering. So we've worked a lot in oncology, and what we found out in research is that patients really want to see real pictures, just like them. A lot of the industry thinks that we need aspirational pictures. Well, shouldn't we show pictures of patients and how they want to be? And that ends up looking like people running across fields and in the beaches, and patients don't appreciate that. They want no hair, the good, the bad, the ugly, exactly as they look themselves. And it's very important to give them empathy, not advertising. So we were working on, and my teammates will remember this in the back, we were working on a metastatic breast cancer program. And we were developing a look and feel and some messaging and a logo. And of course, we decided to put a pink ribbon on it, because what else would you put on for breast cancer patients? And right before we launched, we decided to actually ask some metastatic breast cancer patients what they thought of our educational content and all of this look and feel. And they hated it. They said, we don't identify with the pink ribbon at all. Pink ribbon is about hope. It's about adjuvant breast cancer patients, and we consider ourselves to almost have a completely different disease. We're metastatic. We don't want to see any of that pink ribbon stuff. So had we launched, we might have actually insulted them, and for sure we would have demonstrated that we didn't understand our target. So really, don't generalize. Figure out what the nuances, even within one patient population, might be so that you can really, really be specific. How many people have gone into a doctor's office and you think you know what you want to say, how to describe your symptoms, you see the white coat, you get into the room and your mind goes blank, especially after perhaps you've heard some bad news. This happens all the time and it's real. Patients don't know how to prepare properly, and so when they get into a doctor's office, they kind of blank out. We saw this a lot in women's health with some serious conditions where outside of the doctor's office, women would describe their symptoms as, just devastating, couldn't go to work, no quality of life, depressed. Once they got into the Obgyn's office and the doctor said, how do you feel? They said, oh, I feel a little crampy. And they just completely forgot how to articulate their symptoms. So understanding that that might happen in the doctor's office, it's really important to remember that we have to support them by providing them almost with a script, if you can, questions, Q&A, bring someone with you, just all the tips to make their visit successful. Don't talk down to patients. So health literacy is a really big topic in patient engagement, and oftentimes there are some rules about, the 4th to 6th grade reading level for developing content. But if you're talking to some patients who have some serious diseases, like in oncology, their health literacy is very high. 12th grade would be the minimum of how to talk to these patients. And if you were to actually write some content or provide them with content on the 4th grade level, they would feel very condescended to. And so again, the theme is really understanding who you're talking to and what kind of information and at what level to be providing them. So we were working with gout patients, and I don't know if you know anything about gout, but it's called the rich man's disease. It's often associated with overeating and smoking, and the target for patients is pretty much men in their 30s and 40s. And so we were working with a client, and community support often comes up. Let's have a support group. Let's all get together and talk about our disease to really support these patients. When we actually asked gout patients how interested they were, only 8% said that they would be even remotely willing to come to a support group. And so the investment in creating that community support really would have gone out the window. So a lot of patients don't want to identify themselves with their disease. They don't want to talk in a big group, and some really do. So it's important to understand who does and who doesn't. And, could that be the surround sound for your product or service? Oftentimes, there's a double-edged sword in terms of giving patient tips and lifestyle information. Sometimes it comes across to certain patient types as blaming or us wagging our fingers at them. For example, if there's a condition, let's say lung cancer, where patients feel guilty about the disease, there's an assumption, oh, you have lung cancer, I guess you were a smoker, I guess you didn't live a healthy lifestyle. If we're developing content for patients that could somehow be interpreted as blame or a should've, could've, they're going to shut down and sort of reject that content. So being really careful to understand how to give them helpful advice versus content that might actually come across as blaming. Last one, this is, I think, really important in terms of caregiving. So caregivers run around, they've got a lot of tasks. They have to make appointments, pick up prescriptions, do the shuttling, driving, do laundry, do shopping. Often it's the eldest daughter in the family who ends up caregiving, especially for a parent. They actually forget to talk to the patient and ask them what they want. And what patients are looking for is respect and humility. And they want to talk about things like environment and control and how they feel. And of course they need their prescriptions picked up, and of course they appreciate the laundry being done. But the logistics should not take precedence. What patients really want is to feel respected. So I'm going to talk for a second about the 3 pillars. No matter what digital tool you're leveraging, and I know today there's a lot of discussion around how to connect digitally with our patients. And again, I've seen a lot of great solutions, but there really are a couple of things that remain consistent in terms of building that relationship with your patients. So number 1, listen more than you speak. As an industry, we talk a lot. We give out a lot of information. There's a lot of resources, a lot of links. We have a message. It's kind of selfish in a way. We have features and benefits and all of this. Listen first and listen even more than you speak. So research, I'm sure we're all familiar with the different kinds of research, whether it's down and dirty, qualitative, quantitative, super important. Just have one-on-one conversations. Even just having a handful of patients to talk to or caregivers to talk to can really make the difference. Simple surveys. How can you fold a digital survey, 3 questions, 5 questions, into whatever tool you have? If it's an app, serve up a survey at the end of it and ask a couple of key questions that are going to help guide the next phase or help guide your communications or help, really respond to the patient's preferences. one size does not fit all. That's really the theme of what I've been talking about. Message, channel, frequency, duration. So when I talk about patient engagement, we do a lot of communications outside of an appointment or outside of an interaction with a digital tool. This is the surround sound that I'm talking about. This is the in-between. And so what you say, how you're going to say it, how frequently you want to deliver that message, and for what period of time is really the crux of it. This could take a really long time to figure out, and a lot of thinking should go into the strategy. Consider things like condition, stage of the condition, demographics, and preferences, as I said before. So educate. This is, really key. Patient education, patient engagement, I think are very much synonymous. And there are so many different areas to educate on, whether it's preparation, shared decision-making, really setting expectations for patients. We're working with a customer now who is in the diagnostic business, and one of the key issues that they have is that patients don't understand what the test is going to be like. And when they get there, they're turned off and they don't want to take the test. So if some education had gone to that patient beforehand to help set their expectations about what was going to happen, their throughput would be a lot better, patient satisfaction rates would go up, and they would probably refer that test to friends and family as well. So just a couple of tips for you as you think about, and maybe you haven't thought about building a patient engagement program or surround sound, but as you think about it, just a couple of tips. What should you say? So the message, really important. And definitely don't wonder what you're going to say every week or at every interaction. It needs to be planned out, probably a year in advance. Content is king. We all know that. Make it bite-sized. Make it very tailored. Be transparent. Again, back to the real pictures. And credibility is really key. If a patient senses, and their radar is so up in terms of transparency and credibility, if one thing or one element of your communications doesn't seem credible, they're probably not going to interact with you again. So really spend time on this. There's a lot of stuff in our industry. I've worked with pharma and biotech for the last 20 or 25 years, and there's just a lot of stuff that gets created for patients, videos and tools and white papers and testimonials and just all sorts of stuff. And you only need one or two. You really do. More isn't better. Just, really keep it simple. Segmentation. So in terms of tailoring, this is a hot button, at least in my business. Understanding who your patient segments are so that you don't end up talking to everyone the same way. But there's the other side of the coin, which is over-segmentation. And that means I want to talk to each and every person and create 100 different segments. That's really difficult to do. It's very expensive to create content for 100 different segments, and you're not going to be able to analyze it. One of the keys for patient engagement is being able to look at the data on the back end and see how patients are engaging, what's most relevant. So have a couple of segments, 2 to 3. Know the channel. Ask people what channel. This is a sample survey, result from a survey that we did, and clearly these patients want email or they want to hear it from their doctor. If we had launched with the mobile app, it would not have been used. Only 8% said they wanted to receive patient engagement in a mobile app. So remember the 3 pillars: listen, tailor, educate. And back to what patients want, it really is about trust and value. And I'll just leave you with this. Whatever you're working on, whatever business it is that you're developing, make this trust and listening to patients part of your culture. And I'll give you an example of something that I did in my company. We, as I said, have worked with lots of different patient types, and people working on my team didn't necessarily have direct access to talking to patients. Some of the folks that work with me were lucky enough to listen in on interviews, go to focus groups, meet some patients, but most of the staff were working on programming, they were working on data analysis, and they were pretty far away from the patient. So I decided that each week in our staff meeting, we would bring in the actual recordings of patients during our interviews. And we listened to a different recording every week for 5 minutes. And I'm just getting the chills thinking about, the different voices and just hearing the patients and what that did to the staff in the room. Just hearing actual voices of patients who needed something, who were struggling, and who needed, education and help and better treatments. And so bringing that to the table, bringing that into our staff meetings really helped everybody in the company understand what our mission was and what we were working on. We were working on helping real people. Yes, we're working on the next best iteration of our tech platform and our data analysis, but this is really at the core. So I would challenge everybody to think about how you can bring that into your culture. And so, my vision is that by applying some of the things that I've talked about today, we can move from a world where there's not enough time and there's confusion and there's a lot of harried appointments to a place where patients are empowered and educated and motivated as they go along their journey. Thank you. That's you.
So we have time for a couple questions.
Yeah, of course.
Anybody?
How selected groups that you survey? So how do you really have a diverse group that you're getting down with?
So how do you know it's diverse?
Diverse
Or-
and like a good representation of what you're looking for. So you're not just channeling like one voice of customer, right? And then you put something out there and really satisfy the needs of everybody.
So the question is, how do you make sure that when you do a survey that it's diverse, that you're talking to a sampling of different people and not just one type of customer, right? So, depending on what your service or product is and, how you're accessing patients, let's say you're working on an app and you actually have people enrolling or you're actually capturing data. Obviously, there's some data analysis that can be done in terms of demographics, in terms of behavioral metrics, like, is that person diagnosed person, or is that person just symptomatic, or where do they live? And you just want to make sure that you have a varied sample. And it depends what you want to know, because there's qualitative and quantitative. If you want to get a read, like I was talking about the pink ribbon, that's just a qualitative. We didn't need to do a big 1,000-person quant study. After you talked to 5 people, we figured out that it was a bad idea. But really making sure what your goals are. Sometimes we want to make sure that we have 100 of every segment that we're talking to, and sometimes we want to talk to a couple. Depends on timing and depends about what you're really trying to get at. If you want to talk about it after, I'd be happy to.
One more question?
So I'm curious, I like your point about listening to get to inform your content. But after you make your content, what type of listening do you do? What kind of feedback are you getting from your patients to make sure the content is actually up to date and dynamic and progressive?
It's a great question. So, depending on what industry you're in, so I'll talk about the pharma industry is obviously very closed. We're not allowed to get a lot of feedback from the patients. We can't have replies to emails and things like that. So we use a lot of engagement metrics, and we test as much content as possible. So, for example, first of all, we ask the patients what kinds of content they'd be interested in. And we know that they're going to be hyper engaged if we serve them content that they said they were interested in the first hand. But every day, we can look at live data that tells us topics that are being opened and clicked, how the content is being interacted with, whether it's being downloaded, forwarded, shared, rated. All of those kinds of functions are really important to include with your content. Don't just, create a static piece of content that doesn't have any interaction capability. In markets where you don't have to worry about the closed environment, ask for their feedback. Ask them to reply. Depending on what industry you're in, I think but the data is very important, the engagement data. And then doing third-party data, we go back a lot of times and do a third-party quantitative study to ask patients how they used the content, what action they took. You were exposed to this, what did you do later? And we measure on an ongoing basis.
Okay. Thank you so much,
Thank
Danielle.
you.
That was excellent.
Thanks for
I really
having me.
appreciate it. Thank you. Okay, I'd like to have the judges come up, please. Kareem, Michael, Joe, Daniela. Take the Shark Tank seats. Yes. Okay, why don't we just, I think, introduce yourselves a little bit?
Sure. Kareem Farag, I'm co-founder and CEO of Connect to Care. We're an early startup, about a year old. We're in an accelerator across the river, Entrepreneurs Roundtable Accelerator. And our product is a personal health assistant. It's a mobile product that translates symptoms into when and where to access medical care. So we help users understand where they can seek care nearby based on their symptoms.
My name is Mike Ehrlich. I am a recovering entrepreneur. I sold my company about 8 years ago. Since that time, I've joined the faculty. I'm a professor at NJIT. My principal area is finance. My specialty is innovation, entrepreneurship, and commercialization of new technology. And I've been an angel investor for somewhat over 30 years.
I'm Daniela. I think you know what I do. I've founded 2 companies in this space, and I love patient engagement.
Let's see. So again, I think we all introduced ourselves in the beginning. So I guess we're just excited to see the companies that are selected to present. And I've been here before in this same audience. So same I guess platform. So I wish you all the best of luck. And the winner's going to get a meeting with our investor in Epion Health, Deerfield Management, Leslie Henshaw. And she's a partner at Deerfield Management, so I think you all know about that. And she's also a board member, a fellow board member of mine. So she's a great person to get to know. And whoever does win tonight, I definitely think that you're going to be glad that you get that opportunity to meet with Leslie. So just want to give a little kudo to Leslie as well for offering her time to meet with the winner tonight. And I'm sure that it'll be a great meeting for y'all.
Okay, so we're going to announce the top 3 startups that are going to come up and demo. And you'll each have 4 minutes to demo, and then we'll have 4 minutes of questions from the judges. Okay, and we will time you, so please try to stick to your 4 minutes. And I want to just thank all of the startups that pitched upstairs. I thought you all were fantastic, and it was really a tight race overall. So you should all feel really good about what you came here tonight and what you've been able to achieve, and hopefully you've made some great connections. And as Joe said, you're welcome to follow up. And there again, Health 2.0 New York City will have more events coming up. We have one next week, April 8th, in New York City at NYU Stern Graduate School on Mental Health Digital Challenge, another huge area where there's a lot of need, and we're looking for technologies to increase access and quality. So keep tuned in for more events to come this spring. Okay, so without further ado, I'd like to announce coming in 3rd place, AuthenticScripts. So if you'd like a round of applause. Okay. The runner-up coming in 2nd place, Cardiometrics, Benji. And coming in 1st place, Little Turtle. Congratulations. Okay, so let's start with AuthenticScripts, if you'd like to come up and give us a 4-minute demo. Charlie came all the way from Atlanta.
Well, I think most of you that I've spoken to have either passed by the booth until we get everything set up. How many people, by a show of hands, has actually used Priceline.com before to buy a ticket, hotel, car? Okay, cool. So you're somewhat familiar with what we do. We provide transparency in an open market platform for prescription medications. Think of Priceline.com. So when you prescribe medication from your physician now, you have the option to actually name your own price for that prescription based upon the current inventory of pharmacies that are geolocated in your area. So if you have a medication that has a high out-of-pocket cost of, say, $150, and you can only afford to pay $75 for it, you can actually negotiate that price in cash or whichever means you decide to pay for it. And once we get the site up, I'll show you exactly how it works.
All right, you good?
Yes, thank you.
Sorry about that.
No problem. Well, real quickly, I'll let you guys watch the video. It's very quick. It's only a minute and a half. That'll eat up some of my time because the demo is pretty quickly. It's not even good. Well,
And both of them have a reasonably high out-of-pocket cost for their prescribed medications. Mary and Tim some form of presumed health savings medication card until they found AuthentisScripts.com. AuthentisScripts is the first online name-your-price prescription portal designed to allow people like you, Mary and Tammy, to name their own price for regularly prescribed medications with local U.S.-based pharmacies. The process is simple and easy. Your physician prescribes your medication. Your prescribed medications are automatically linked to your account. Once you create an account with AuthentisScripts, log in, click on your prescribed medication, and you will automatically see all the participating pharmacies in your local area that carry your prescribed medication and the current price to fill it. If the price is too high for your budget, just click Input Your Price and click Make a Bid. The process is just that simple and easy. The pharmacy you choose to negotiate with views your negotiated price. If they like it, they accept your price. Once accepted, you will receive a message stating your price has been accepted, and voila! You get your prescribed medication at your local pharmacy for the price that you can afford to pay. AuthentisScripts.com. Simple, easy, and it just makes sense.
all right. So that's a really low-level description of what we do. I'll give you an actual walk through the site itself as a patient. So I'll log in as a patient really quickly. And I use some of the same account information that I used in the actual demo at my desk upstairs. So nitroglycerin, doxycycline, Zythermax, lidocaine, just some very popular medications that we already know of. So we'll click on Zythermax right here. And basically what you will see is you will see the actual medication itself, their price, and the price that you chose to bid on. That's a bad example because we chose 80 cents for a $3.50 drug. But we'll go back to say one that was relatively more expensive, and we'll go like to the Tetra capsule right here. And it was $2.85, but actually I'm sorry, $298.50, and we chose $150. And on the actual pharmacy side, you'll see an actual Twitter style feed where it shows all the medications. It'll show the exact actual price that you have for it, the price that they chose to pay for it. You can either accept it or decline it based upon the profitability that you like to choose in that medication for that particular time. And the cooler part about it too is once the actual prescription itself, the actual auction process is done, you can hit print prescription, and you get a digital prescription at this point with a 128-bit barcode. And what that barcode contains is the actual physician information, the drug information, the signature from the physician, as well as the actual winning price. And you take that, either you can populate on your mobile app, your tablet, or you print this off and you take it to your physician that actually won. They scan it, and it null and voids that drug throughout the entire system. We actually have a back-end system as well that notifies the DEA that drug has been filled, and so that drug can never be filled again in the U.S. So just think about prescription hopping. We've just alleviated through our system as well, too. So let me try to find one that's actually still out for bid. Let's see. I believe it was tetracycline. And right there. So basically, tetracycline right now is selling at SFCNRX for $78.40. And we'll just say I want to pay $65 for it. Click Make a Bid. And that's it. It's already sent off to SFCNRX on the actual pharmacy's dashboard. They'll see your price was $65, and they can accept or reject it based upon what they can afford to profit-wise, either gain or lose on that medication at that time. And so it allows you, the actual patient, to name your price for that medication, get it at the cost you want. It provides the government, which is what they've been pushing for decades, transparency. And it's a tool for the pharmacies as well to generate revenue and foot traffic in their pharmacies, more so for the independents over the CVSs and the Walgreens or the bigger mom and pops. But it's a tool for everyone on every platform.
Thank you, Carl.
Thank you.
Questions from the judges?
great presentation. I think, so a couple questions. One is, who's the target audience? Is it basically cash payers, folks that don't have prescription benefits or insurance, so they're paying cash for their prescriptions?
Them, and as well as if you looked at, on the patient dashboard, there's a portion that says whether you have insurance coverage, yes or no. So some of the people who have insurance, the price you're seeing is what's already been negotiated after your insurance coverage kicks in. So that would be your out-of-pocket cash price, whether you have insurance or whether you're a cash person. Obviously, if you're a cash person, it would be a lot higher. So you're negotiating whether you have insurance, a high deductible, or a high out-of-pocket, or you have no insurance at all. So it's
Okay.
for pretty much everyone.
And then just to follow up to that, so how does this play with folks that have like prescription benefits cards that offers them?
Well, we're not a prescription benefit card. I'm not sure exactly how it will play in with them, whether the 80% can actually, or 20% that they actually allow you to save can actually go on top of that. I can only tell you about what we do. And what we do is we try to we give you a tool that allows you to get the lowest price possible for what's going to come out of your pocket at that time.
So, Charles, how do you make any money in this process? What's your business model?
Okay, well, for the actual users themselves, the patient, there's two actual models, ranging from $199 to $14.99 a month billed annually. The $199 is for one individual person with four transactions per month. The $14.99 is for a family of 6, 2 parents, 4 children, up to, well, actually unlimited transactions for that particular model. And for a person who's very infrequent, we charge the second option for the user is a 5% per cost of savings. So if you save $20 per prescription, we'll charge 5% of that $20.
So it's all subscription-based in terms of revenue. You don't get a part of the transaction fee at all.
Yes, the 5% transaction model, that's not a subscription. That's just if I go in once or twice a year, I'll just charge you 5% of what you normally would save on that, what you save through the site on that medication. So like I said, if you save $20, we'll charge 5% of that $20. So say if you go in there every 6 months for a allergy medication, and you save $15, we'll charge you 15%, we'll charge you 5% of that $15, excuse me. And if you go in there quite frequently, say you have a child or a parent or whoever that has a frequent disease or a frequent medication use, then it would be more beneficial to opt into the subscription model because it would save you a lot more money. You can lock in your costs for the site. And for the pharmacies, they can either white label the product, or they can actually, for them it's free. Everyone is free. For the physicians, pharmacies, and for the user for the first 6 months it's free. For the pharmacy, it's free for lifetime unless you want to opt into a couple of different options that we have to make the usability a little more friendly, as well as white labeling the product as well too.
Thanks. Just wondering about your customer acquisition strategy on both the user and the pharmacy side, and how much volume you have right now.
On the pharmacy side, we're more so going after the independents because they seem to be the ones that have lost the most revenue in this current healthcare cycle that we're going through. You got the bigger mom and pops, the CVS's, the Walmarts. They're basically killing them. And we're just going out of the beta testing phase. So we had 20 users. We've lost 5 of them just due to sheer attrition. So we got 15 right now that are still actually beta testing the site. We have 2 pharmacies and 1 physician.
15 users.
Users,
meaning
patients.
People.
Yes.
And
2 pharmacies and 1 physician. Yes.
And what's your strategy in terms of how do you see yourselves ramping up?
Ramping up as far as usability or acquiring customers?
Acquiring, how are you going to go out and get more users and more pharmacies?
Well, our basic marketing strategy right now is social media. We're targeting not necessarily millennials because they're relatively healthy. We're looking at single mothers. We're looking at baby boomers. We're looking at individuals that are right at the cusp of retiring and people who are retired. Now, most of them we can't reach with social media, so we have a mail marketing campaign. We have an email campaign as well, too.
And pharmacies, do you have a sales force? Or
Pharmacies, for the independents, it seems to work with pharmacies more so if you walk in and actually talk to them, because 9 out of 10, the pharmacist is the owner of the pharmacy as well, too. So it's for us, I found it's better to have that one-on-one relationship and show them the face of the company and the product as well versus the flyer.
Thank you.
You're welcome.
So I'm interested in kind of the approach that you made in terms of steps. So it seems like actually a pretty robust platform from a technology standpoint. Obviously you're in your beta stage here, but it seems like you built something pretty powerful. But from what I can tell, I don't know what's behind the scenes here. But how much did you test the market in terms of market validity and finding out from both sides? You have to have, in your case, you have 2 different market segments, or patient and also the pharmacies you have to match the two up. So did you go out to pharmacies first and ask them if they were interested? Did you go out to patients first? How much did you validate what your business model was before you built this?
I did a focus group, actually. Completed a focus group with 2 physicians, 2 pharmacists, a healthcare CEO, and 2 patients, and an insurance payer, too. And we ran them through the actual site itself. We asked them a series of questions, and we gave them a couple of different scenarios. And they were all relatively high-level individuals in their fields, including, I guess if you want to say a user, a patient's high-level in their field. They're human beings. So and we validated the product. we validated the product that way. And for us, that was between that group of people and the answers and the feedback that we got, that was enough for me to say, okay, I'm going to go ahead and then build it.
Just one quick follow-up question. I think we're probably close to out of time. Where is this technology in terms of, are you in a very beta stage of the actual technology, or are you fairly well built out? Like, what's on the back end of this? So where are you in your stage of build?
We're built out. This is a live site you can actually go to right now and sign up for it. But in order for you to actually use it, your physician has to connect you with your account. So we're trying to get the physicians on board as well as the patients and the pharmacies themselves.
Thanks for me, and best of luck.
Oh, no. Thank you all for the time. Thank you.
Okay, next up is Benji Strauss from Cardiometrics. Now we have a device. Bringing the device. Plug in.
All right, I'm Benji Strauss. I'm the CEO of Cardiometrics. My partner, Eric, is in the back. And what we've done is developed a system for comprehensive home monitoring for heart failure patients. And exactly what is the problem that we're solving here? And the answer is that in the U.S. alone, there are about 6 million heart failure patients. And each year, 1 million of them end up getting readmitted to the hospital because we have poorly monitored their health status. And we only detect that their heart failure is becoming a problem again once it's too late to reverse in the home. Now, why is that? And the answer is that the way we monitor heart failure in the home now sacrifices high-quality advanced biometrics in favor of usability. So what we do now is limited to having a patient stand on a bathroom scale for the most part. And what that results in is the readmission penalties that hospitals can incur, as well as the cost to Medicare for reimbursing for it. That's about $17.5 billion a year. And on the other end of the spectrum, the patients pay with a reduced quality of life, potentially reduced length of life. And again, that number is at about 1 million readmissions per year. So how have we solved this problem, or how are we working to solve this problem? And the answer is that what we've done is maximized the quality and number of advanced biometrics that you otherwise couldn't get without at all sacrificing on that usability. So whereas previously, or even currently, again, monitoring is limited to just the bathroom scale, what we've done is we've built it out just a little bit by adding handlebars, but by also embedding electrodes and sensors right in here. So when the patient stands on this, just like this, without socks or shoes, we acquire not just weight, we can also look at their heart rate. We can look at 6 different views of EKG diagnostic quality, which would otherwise, in any other system, require electrodes and electrolyte gel and abrading the skin on the chest. We can look at respiratory rate to check and see if the patient's lungs are being taxed too hard. We can check and see if there's any fluid accumulating in the lungs. One of the hallmark signs of heart failure. We can also check for fluid in the legs. Have you ever seen a patient with those tree trunk legs? Probably a heart failure patient, accumulating all that fluid. And we can check pulse oximetry and also balance. And so we can get a really comprehensive picture of what's going on in the heart failure patient. And after that, we can ask them the subjective questions like how they're feeling, if they've been dizzy, if they had nausea. Now, all of that is then sent to the clinician, and imagine this being a full computer, and we can look at things like their EKG. And the idea here being is that we can, since we do this every single morning, we can trend and determine what the patient's baseline is, what's normal for them. And once we have that context, we can then very easily determine when there are deviations from that baseline. Now, the reason that's so valuable is because once we can determine, right, once we have the baseline and once we can detect really early on what deviations might be, we don't have to wait until the patient has gained 10 pounds and has 2 liters of fluid in their lungs. We can detect it much earlier so that we can reverse that heart failure decompensation without the patient requiring a hospitalization that'll take 3 days and $60,000. We can have the clinician who's monitoring this once a day call them up and say, hey, you should take 40 milligrams of Lasix today instead of 20, increasing quality of life to patients and also profoundly reducing the cost. So how do we actually market this? Well, because there are a number of other solutions that have started to get on the market, one thing that they all do is they have great software, but they buy their hardware off the shelf, and it's very expensive to them and very hard for the patients to use and comply with. And so where our value comes in is we can provide to one of these companies that's coming into the market. So say a Bosch or a Care Innovations, Welch Allyn, or a Honeywell, those are the big players. We can provide them the opportunity to have a profound competitive advantage in the hardware market, which will enable them to not only increase the compliance no matter what, but also reduce the readmission rate and therefore acquire a much bigger market of hospitals who use their solution. Since we've been funded in July, we've completed a final prototype, and we're working to start a pilot study and submit our 510K so that we can market and find a partner.
Thank you, Ben. Yep, so I saw there were some patents pending. You're waiting, or you already filed your 510K?
We have not filed our 510K yet.
Okay. What do you see as the barrier to that? And what's your how big of a hurdle is that for you in this market with this type of hardware?
The 510K is not hard. This is a Class 2A device. So we have all the information, all the bench data we need today to submit the 510K. The only reason we're holding off is that we want to make sure that we also have trial data around the same time so that we can really cascade into a lot of action, right? One thing we don't want to do is get a 510K clearance, right? Telegraph everything that we have and not have data that will enable us to find a partner immediately and get to market. We don't want to give anyone a heads up on what we're really doing and what the technology behind it is. And so we're holding off until we're ready to publish some trial data.
Okay. So I guess that there is a follow-up. I'm going to hold off just because of time.
Okay.
I have a lot of questions, so I don't know too much about devices, but how much is this? Who pays for it? And part two is when I look at something like this, again, just my naivete, my mind goes to like, is this going to be a wearable device in 3 years?
Right. So let me see if I can remember all of those. In larger quantities, this will cost us about $500 to $600 to manufacture. To give that a little bit of context, right now what Honeywell charges when they package their off-the-shelf blood pressure cuff and pulse ox and Bluetooth scale, it's about $3,000 with the tablet and the app. And so we have a lot of wiggle room to kind of find the right partner and kind of find the right number, dollar value that we want to sell this for. So that's one. As far as who pays for it, right now there is a reimbursement code for home telemonitoring. It averages about $150 a month for Medicare, for reimbursement, obviously varying a little bit state by state. And so to start off, right, the strategy in the short term is to use that to cover us to get reimbursement for it. Now, in the longer term, what we want to do is do a large trial to show that we have improved outcomes, to show that the only way to to really further reduce hospital readmissions is through our device. And if we can prove that, we can then say, well, we do a better job, we can command more from reimbursement, and then we would apply for our own reimbursement code. As far as wearable, you don't want to have more data than you can handle, and you don't want to have more data than is actionable, right? So having a wearable device doesn't really present an advantage, right? Because this is data that we really only want to get once a day. We don't need to see how much fluid is in their lungs, at 9 a.m. versus 10 a.m. versus 11 a.m. We need to see what it is in the long term. And we can do that by just having something that you stand on and hold for 15 seconds a day. Probably better compliance than wearing something all day. Now, there are some metrics that are valuable that would require wearing for a longer period of time. It's not what this is for. we could potentially integrate with it, so something like a Fitbit to measure heart rate all day long, but that's something that's really discrete from this.
Okay, thank you.
So I think you have a complicated customer ecosystem, right? So you
Okay.
have a patient, but they're not buying the device. They need to use the device. You have a doctor who's maybe prescribing the device. A hospital, the benefits seem to go to the hospital for the readmits.
That's right.
The insurance company maybe gets some benefits as well, but there also needs to be kind of somebody that's actually monitoring the telemetry data and following up on it.
That's right.
So all of those people actually need to be winners in this process in order for you to be able to go to market effectively. So can you quickly sort of run down what the benefits for all of them are and how you actually capture those?
Okay, well, for patients, right, we know that if we can prevent them from being readmitted to the hospital, right, quality of life improves, potentially length of life improves. So we know that patients win from this. Hospitals, right, by sending these out, even if there are some hospitals that don't even collect reimbursement on this. There are 2 hospital systems, one's out in South Carolina. I don't remember where the other one is. But they're just looking to give this to patients to prevent them from being readmitted within 30 or 60 days so that they're not penalized and don't take a 3% cut in reimbursement from Medicare. So hospitals win as well. Doctors are employed by hospitals, right? So ideally, right, when a hospital does better, the doctor does better too. Now, on an individual basis, right, really the physicians who would prescribe this would be hospitalists, right? Those who are treating their heart failure patients who are admitted to the hospital, diagnosed with heart failure, and then discharged, right? And so to improve individual doctors' readmission rates, right, this would also help do that. Am I missing anyone?
Insurance companies.
Right, so where insurance companies win is really not in the 30 days after discharge, but is within anything longer than that. So we're talking about 60 days post-discharge or 6 months post-discharge, right? Because when insurance doesn't have to cover the cost of readmission is within the first 30 days. That's when hospitals have to pick it up. But readmission rates are still incredibly high after 30 days. And so if a patient decompensates and needs to be hospitalized on day 31 after their discharge, then the insurance company, or Medicare or the payer, has to cover it. And so this becomes extremely advantageous to them, particularly in the after 30 days post-discharge.
And the last one is monitoring, which I worry about sort of the malpractice of people not paying attention to the stream of telemetry data.
Right. In the big picture, we'd like to have this cover entire hospital systems, not individual physicians. And so what that would entail would be a hospital system being a client of a remote monitoring center, right? A lot of them are I believe, in Pennsylvania, I know. LifeWatch has their big monitoring center there. And that's where people are paid full-time to monitor this, to monitor results. And again, we're also looking to integrate this into, okay, sure.
Last question. Okay. These guys covered most of the questions, but where I was confused in your presentation is when you talked about like Honeywell and some of the other. Are they partners where you're selling this device and they can kind of sell it into their channels, or?
That's right.
Okay,
That's
so
right. They have great software.
Right.
They have no hardware. They're buying
so you're
the hardware
basically the
elsewhere.
hardware solution to these,
Correct.
let's call them value-added resellers that have
Exactly.
relationships with hospitals already, or ACOs, or whatever?
That's correct.
Okay. And, okay, great. I'll just stop there.
Okay. Thank you very much. Round of applause. Emily?
Well, while we're waiting, I'd like to thank you for all of your votes. We're really excited to be here. All right, here we go. I'll just... Okay. So I'm Emily Garber. I got to meet a lot of you upstairs and really enjoyed talking with you. I'm here to share with you an innovative nutrition app that I've created as a pediatric dietitian with 8 years being a registered dietitian. And one of the most common things that is a struggle for families is that they hear my suggestions, say, yeah, we know what to eat, but I don't think my kids will eat this. And as a pediatric dietitian with my specialization, I hear it all the time, and maybe a lot of you can relate to that if you have kids or have worked with children. And there's a lot of reasons why some children may struggle with eating a nice balanced diet, a variety of healthy foods. It could range from anything from general picky eating. Studies have shown that 62% of kids in America are reportedly picky eaters, which translates to 15 million children in our target age range of 6 and under. Quite a big issue just for picky eating. Not to mention the wide range of medical conditions that are also associated with feeding challenges, such as children with autism spectrum disorder or sensory processing issues, which makes it difficult for them to accept new foods and to expand their diets. And as a pediatric dietitian, I've worked with teams of feeding therapists, physicians, pediatricians, as well as social workers, behavioral therapists, to help these children expand what they eat. And in order to enhance the ability to empower parents to follow through on our feeding therapy recommendations and nutrition recommendations, I've created an app called Tiny Tastes, which is a mealtime companion app designed with our adorable little friend Tiny, which joins children on their journey to try new foods. So while the parent or caregiver is preparing the meal, they can read a story where they go on all kinds of fun choose-your-own adventures with Tiny throughout the yard, and at the end of the story, Tiny comes home from playing in the yard, she's hungry, it's time to eat, and you take a picture. For some reason, this is a little off-kilter. Can you all see the top's okay? I apologize, that's strange. Anyway, you take a picture at the end of the story, which uploads into the app, as you can see here. Whatever healthy meal or snack you're feeding your child, take a picture with the app. It uploads into Tiny's little bowl, and she's so excited as she joins them in eating this new healthy food. Kids love it. The little 2, 4-year-olds, they really think Tiny's joining them in eating the same foods as they are, and it inspires them to want to try new healthy foods. Additionally, we've added a gamification component where children can earn coins for trying new foods, whether they taste some, eat well, the whole plate, what have you. And with those coins, they can buy beautiful plates and bowls, spoons in the Tiny store for Tiny to use while she eats, because studies have shown that as children have more choice throughout their meal times, they're more likely to engage emotionally and psychologically with the eating process and want to join in eating the actual foods. So it works as a network. So the reason why we're here tonight, though, is not because we just have a patient empowerment tool to empower families to make healthy changes. We're also a provider engagement tool where the photos that are taken with Tiny in the app are uploaded into our seamless web portal where the photos are transmitted from app to web. And those photos are displayed online where medical providers, dietitians, feeding therapists, what have you, can view at any time what the child's eating. The parent sends them an invitation. The therapist can log on either between visits to monitor the child's progress or during the visit, because currently this is what we usually get. If we're lucky, actually. A handwritten sketch of, 4 ounces of this, 1 bite of that, which, as you can imagine, as a busy parent, is not the thing that you want to spend your time on. You're willing to, but not ideal. And it's not ideal for the professionals either, because it's time-consuming to analyze these and not usually worth it, given the type of sparse data that we often receive. Even less accurate is the dietary recall if the parent forgets or doesn't keep the diet record by hand. We say, oh, what's your child been eating for breakfast lately? What have they been eating for lunch? And it's even less accurate and representative in that case. So here you can see an excerpt from Tiny Taste Pro where the food photos are pulled in. And this is meant to be when you hover, if this was live, you hover over the photo of the food, and it shows you both a before and after picture so that you can see not only what the child is eating, but how much. And it also comes with little comments. A parent can choose to say, the reason why he didn't eat any was because he was hungry, or had a fever tonight, or stomach hurt. Give some kind of comment to the provider in the moment, if they would like. Not necessary, but optional. Additionally, on the back end, what we're able to do is quantify the data that we receive through Google Analytics, which is put through parse.com as our API, which connects the app to web portal, and then displayed through charts.js to display these statistics and data about the feeding process. Things like, what percentage of the time is the child eating all of their meal versus none of their meal? For example, how long is the average eating session? etc. Both capturing that valuable data that providers need for their charting, as well as empowering parents to be able to monitor their own child's progress and see how they're doing. So as far as the business model, I wanted to briefly go over that because it's a common question from the panel. What is our revenue model? Essentially, there's a huge market for this. As I mentioned, 15 million children in the United States alone are picky eaters, and we actually have users from all around the world. Being a kangaroo is our main character, we have many from Australia, but also many other countries. But this just represents our market size in the US. And even from that, just from the app downloads, we're able to demonstrate a $30 million market potential as a total available market. Additionally, we have a subscription model, which we just summarized here. It's tiered out, the different pricing levels based on how many patients the clinic is using. The clinic can choose to have a subscription month to month where they provide Tiny Taste Pro web access to their patients to enhance that communication. As well, a parent could decide to buy Tiny Taste Pro subscription for $6.99 a month, and in that case, they would be inviting their doctor to view their own subscription. So either way, we're looking at a total market size of approximately $42 million a year. And this is a picture of one of our adorable little Tiny Taste users. We've gotten a lot of amazing feedback. This was just something that a mom posted on Instagram, along with an encouragement for any picky eaters, parents of toddlers that are picky eaters, to get Tiny Taste. So sweet. We're getting lots of feedback through. We have our blog, we have Facebook. We're pre-revenue, pre-funding. So we are, at this time, doing a lot with social media. We plan to scale to a larger media campaign when we have funding, but we're excited to hear all of the positive feedback so far, and I look forward to your questions.
Very nice presentation. I think it's great. I've got 3 kids, and they're all picky eaters. I don't know. For me, like, I think every kid's a picky eater. So, a couple things. What have you done to kind of validate product market fit? Okay. And want to understand your sales model. It sounds like you're going through channel partners, pediatric,
Clinics.
doctors, the clinics, who's going to refer you and promote this product. But can you just touch on those 2 things?
Sure. I'll take the first one as far as market validation. So prior to our app launch, we did 3 months of intense user testing of children of a wide variety of ages, anywhere from a year to even up to 11, 12 years old, just because the younger children we were testing it with, geared towards 6 and under, had older siblings. So we got a wide range of feedback. We found the best results with children 6 and under, which is why we're marketing as such. We found that 10 to 12-year-olds, they enjoy the story. They think Tiny's adorable. They love Tiny. But whether or not it does the trick to really get them to eat their food better, they were too ingrained by that age for this particular product. So as far as market validation, we did the direct user testing for 3 months, as well as since then, I've also gotten feedback from my colleagues, feeding therapists, actually child life specialists at hospitals are really excited about this because children in the hospital who don't have an appetite need extra encouragement from other types of creative ideas to get kids to want to eat. They're super excited and they had good input, so from my peers as well. And then additionally, as far as market user fit, we're getting a lot of excellent feedback from users themselves. I've gotten emails from moms, experiences with the app directly. And as far as how we plan to market and get this out there, you're absolutely right. Clinics will be a huge partner with us. Thus far, just to clarify for the group, we launched iOS mid-October of last year. We launched the Android app late November of last year. And Tiny Taste Pro web portal is still just finishing development. We're entering beta next month. It will be available publicly in June. But we definitely want to thoroughly test that. We have patients signed up to be early beta testers, and then we'll take on some clinics as well. But as far as once Tiny Taste Pro is live, we'll absolutely have a great funnel for reaching patients through providers. An interesting thing that we found was that parents love it just because it's fun. It helps their kids have fun eating fruits and vegetables. But it's really the medical providers who really understand the importance of long-term consistent use of it, because we see children coming in with failure to thrive, malnutrition, vitamin deficiencies, mineral deficiencies, and other types of struggles. And so the healthcare providers being behind it will just give it that much more carry through in the home.
So you're mostly focusing on a consumer market, and you're talking about kind of a download subscription model for your revenue. And the numbers are relatively low in terms of your, revenue numbers and your target market. And I'm wondering if you're kind of chasing the wrong market in some sense. If you wouldn't be better off kind of chasing the kids who are actually sick because they're not eating food, and where there's actually a diagnosis, and where there's actually going to be potentially a much greater benefit and reimbursement for those things. Have you considered actually kind of like looking at, illness and kind of really trying to talk about focus on that market?
Yeah. And I appreciate what you said about having an actual diagnosis to make something reimbursable, because that is some feedback that we've gotten from our early clinic partners that we're talking with is, the price point was really important to keep moderate, which decreases our revenue potential because they're not getting reimbursed for it. So we kept it very reasonable, very affordable. At the same time, $42 million a year isn't shabby either if we're able to reach our total available market. But obviously penetration rates are not going to be 100%. I understand what you're saying. But as far as a specific, absolutely. But as far as how to target those subcategories with specific medical diagnoses, that's something that we've discussed with our company is what additional products could we roll out after Tiny Taste now that we have the platform built out with the app-to-web integration and have the whole software in place. It would be very easy to change the graphics, mix it up, and make specialty products off of the platform. But at this time, we really do want to keep it for general wellness because that's where my heart is personally. I'm a pediatric dietitian. I want kids to stay healthy. And so if I can be in preventative medicine, that's where I'm starting from. But I'm definitely open to specializing in treating specific diseases as well.
Great presentation. I guess, I raised 2 kids. I had au pairs, probably 8 or 10 different au pairs. And so one of my questions is, I see the healthy food on the plate. The assumption is that the caregiver knows what a healthy snack is. And just coming from my patient engagement and content mindset, thinking about the model where the healthcare professional is pushing this app to the parent versus the other way, where's the education component? Because I guess the assumption that there's going to be a well-balanced, colorful plate of food, I think a lot of the issues with poor nutrition start with the parent. Besides the kid being a picky eater, how have you thought about pushing content and education so that the caregiver is actually serving a healthy meal?
Absolutely, and I really appreciate that you bring that up because as a dietitian, that's what we do is educate about healthy eating, and it's definitely one of my priorities as a professional. So the reason why this product does not evangelize a specific meal plan or a specific this is healthy, because we wanted to make it versatile enough for different types of providers and different types of conditions to utilize the app. For example, someone with failure to thrive, malnutrition, or a child with CF, cystic fibrosis, for example, they have very high calorie needs. They would use Tiny Taste to encourage the child to finish their whole plate, for example, to get enough calories in to help them stay nourished adequately. Whereas a child with obesity on the other end of the spectrum, the dietitian may recommend that their parent use to take a picture of the vegetables on the child's plate. And they know the child's going to eat the rest of it fine, so maybe focus on vegetables. Feed Tiny a new vegetable at every meal. So it really makes it flexible for any healthcare professional that's giving feeding advice to utilize it in whatever way is customized for their patient. And as a professional, I can just speak personally, we have tons of educational materials we give out. We give out flyers, we give out booklets, we give out cooking tips, we give out colorful, beautiful pictures of fruits and vegetables. So really it's the healthcare professional who's going to be giving that education right along with the recommendation to utilize the app. But as far as for the general population who's not seeing a dietitian and may want to use Tiny Taste, we are planning to build out our website. We have a kids zone of the website. We're going to put healthy eating, healthy recipe tips, and build that out. We're, like I said, it's myself and my sister, and we're pre-revenue, pre-funding. So we're starting one step at a time, working on the product, perfecting that. But yes, we're headed there.
Hi.
Hi.
So I'm sitting here kind of just hesitating on what I'm going to say, but I'm going to say it anyhow.
Okay.
I think you should. Let me just tell a story. Not a story, but a round of stories. I presented to more people than you want to know before we raised any money, and we did raise a Series A round last year and some seed funding prior to that. But I probably I won't even tell you how many people I presented to in groups and things like that. I mean, I presented more times than I really want to admit, because it sounds like I just had a bad idea to begin with, and I just had to present 100 times or whatever the number was. But when I presented, I can't tell you how much I learned about what not to do and what to do from people that you present to, like us or other folks. And I'm definitely not the smartest person in this room, I'll tell you that much. But what I will say is that I think that I would suggest to you that you go out and present what you're doing before you go any further and get lots more input on where you're going, because you actually have the most enthusiasm of anyone I've seen in a very long time. But enthusiasm can blind you. So I just would suggest that you kind of get some folks to kind of look at this, at what you're doing from an objective standpoint. And by the way, I love what you're doing, but I think from a business model, I think you probably need a little bit more refinement. And I know I'm not asking you a question, I'm giving you feedback.
Yeah, no, I
and I
appreciate
hope
it.
you don't mind.
No, I appreciate it.
But I really think it's important, and maybe there's someone else in the audience who might hear this as well, because that's what happened with us. And I'm only telling you this because I learned from that, and we made some pivots along the way, and my co-founder is here in the room with us tonight, and I'd love to spend some time with you to talk about that, because I think there are some things that I would suggest that you maybe consider some pivots around from a business model standpoint. From a altruistic, what you're doing, I think is awesome. From making money with it, I think you're going to have a little bit of challenges. So that's just my feedback, and I apologize for not asking a question, but I feel like it was the right thing to do right now.
Thank you so much.
Yep.
Test? Okay, it's working now. Okay, judges, so we're going to take a couple minutes while the judges kind of discuss and choose the winner. So if people want to take a deep breath, stand up. And we're running behind about 15 minutes, so what we're going to do is announce the winner, and then we'll basically end the evening. We're not going to be able to do the panel discussion that we were hoping for. So stay tuned.
Thank you.
Gentlemen, shh. Okay. We have consensus, and we're going to announce the winner now. If I can have some quiet in the room, please. And then we're going to go around the corner to Wicked Wolf, and we're going to celebrate on Sinatra Drive. I'm going to let Michael Ehrlich from NJIT announce the winner, and he's going to give a little bit of feedback to the startups and the entrepreneurs in the room in terms of what it takes to get to that next level. Thank you, Michael.
All right. So 3 really great presentations, and it's tough to do this. Joe's done it a bunch of times. I did it sort of embarrassingly large number of times too, and I probably look at conservatively say 50 startups a month. So I look at a lot of these new ideas, and these were some excellent ones. I'm going to start kind of in the reverse order from which they came up. The first one, Emily, was tons of enthusiasm. I think she's a great advocate for her program. I think that the business model is in some question. I think basically you need to sort of pitch it some more times. I think that the feedback you got from Joe was really good feedback. AuthentiScripts, I think that, again, I think it's some cool technology, but I think your go-to-market strategy is complicated. There's a lot of people you need to bring on board in terms of both, the patients, the pharmacies, as well as the doctors. So I think that's a complicated go-to-market. I think the one that we think is most fundable by a VC in the nearer term is Cardometrics, and so that's our winner. And so our decision was really based on what the impact in the healthcare system was. So really dealing with this issue of congestive heart failure, readmissions in hospitals. That's $17.4 billion a year. That's a big number to be really taking a whack out of. The device looks pretty easy to use, but it seems to be innovative. There's the 3 patents I think potentially give you some protection. And your go-to-market strategy, I think you're thinking about figuring out how to build it, maybe sell it to some people, but eventually what you're going to do is you're going to find a channel partner. You know, you mentioned several large ones here in actually Newark. You even talk to Panasonic. And I think that, you know, somebody could take it to market and really do a lot with that device. And so we think that Cardometrics is the winner who is going to get the meeting with the venture capitalist.
Okay, thank you all. Every startup was great tonight, and I think what the point of this evening was basically was to get feedback, make some connections networking-wise, and keep going. Get inspired. Get the power in yourself to believe in yourself and have the confidence to, as Joe said, keep going. You know, you've got a great idea, you got to keep selling it, you got to keep demoing it, you got to keep getting feedback. I've started 2 digital companies, ad agencies, and the most important thing was getting that feedback from everybody, constantly. So that's what I encourage everybody to do, and keep going. More research to, you know, what Daniela talked about. It's really important to watch those metrics, do the research, get beta partners. And thank you so much for coming tonight, Health 2.0. Thank you, Joe Blewett from Epion Health. Thank you to all the judges. Thank you, NJIT and the Institute of Innovation. So thank you, everybody. We're going to go around the corner and have a couple more beers at the Wicked Wolf. Thank you all.